Between 19 to 50% of all women have problems with sexual dysfunction. In the past, that was a subject oftentimes difficult for you to bring up with your physician, and quite honestly, physicians didn't have a lot to offer to help you, so they would not ask the question about how is your sex life. Well, I'm just here to point out that there are many new therapies available, and we can help with many of the sexual dysfunction issues that plague so many women. There are many different types of sexual dysfunction, and the key is that you're able to talk to your physician about those problems. There's issues related to desire to have intercourse, your response or arousal during intercourse, and oftentimes patients have orgasmic dysfunction, the difficulty in achieving orgasm. And then finally, pain disorders. I always point out to my patients that already struggle with pelvic pain that oftentimes it affects your ability to have sexual enjoyment because sex hurts and it shouldn't hurt. And so the first part is to open up that door to conversation with your physician. Here in this practice, we're going to ask you these questions and help you obtain the help that you need. There are many different causes for each one of those problems, and the causes are different based upon each of your problems. Problems with desire can oftentimes be associated with issues related to your relationship with your partner. It can be caused by issues at work because you're exhausted or stressed out at work. It can be caused by medications that you're on. So a very careful history and a very thorough examination is done to understand what's causing your problems and what we can do to help you out. Once together we have a better understanding about the kind of issues or problems that you have, then we will determine its cause. And, for example, if a patient has problems with desire or libido, there are medications now available that actually will stimulate your desire to have intercourse. That medication has been FDA approved relatively recently and is exciting in the area of libido. The second issue of arousal oftentimes can be corrected with hormone supplementation. We now understand that testosterone is actually more important than estrogen in your ability to become aroused and to enjoy intercourse. Together, we'll carefully look at your hormonal circumstances and we will make adjustments in your hormones if indicated. Finally, there is now material called platelet-rich plasma, which is actually withdrawn from your own circulation and then treated in such a manner and re-injected into the area of your clitoris and your G-spot that will markedly improve your ability to achieve orgasm. That is referred to as the O-shot. When it comes to pain disorders, that is a major part of my practice, and I certainly understand the causes of pain and how that affects your sexual enjoyment. We'll look at the different causes, including bladder pain, pelvic floor muscle pain, and pain in the vaginal or the tissues near the opening of your vagina. Those problems, called vulvodynia, are treated on a regular basis in my practice, and we can help you with each one of those problems. The first step, though, is to talk to us about them and to let us help you. To help you better understand your problems of sexual dysfunction, I have included in my website a list of websites that you can go to. These links are available to you to help educate you and to help you open up that door of conversation with us so that we can help you with your problems.